So thankfully there's not a lot of experience anywhere about the effects of COVID-19 infection in children with congenital heart disease. But given that these sorts of viral respiratory illnesses can affect children with heart disease in a more severe way than the other population, then it's reasonable to assume that we need to be particularly careful about this infection in our patients with congenital heart disease. We would recommend the things that we would normally recommend in any outbreak of severe infection. So, for example, we would recommend that parents make sure that they have adequate number of refills for their children's medication. We believe in the idea of social isolation, and so you should follow the guidelines from your school district with respect to school attendance. And we would recommend avoidance of any unnecessary travel. We would also recommend that parents are particularly careful about hand washing, for example. We know that hand washing is a very good way of preventing the spread of these infections, and that's hand washing with soap and water. And so for now, we don't have a lot of experience about this infection in children with congenital heart disease, and so hopefully together we'll be able to keep it that way. Come what may, I think that our parents need to be reassured that irrespective of what crisis is going on in our community, there are always cardiologists, nurses who are always here available to look after you, to look after your child. And we're always very happy to take questions from parents, and if you have any concerns, feel free to contact us. Something else that parents may like to know about is that there is an online listserv of all cardiologists from all over the world now, and we're discussing some of these issues together so that we can do our utmost to make sure that we can minimize the impact of this infection on your children.